Other factors that can get in your way of a weight loss effort, even if diet seems to be perfect, include prescription drugs. There are many. There's a long list of prescription drugs that can turn off your ability to lose weight. Among the more common, beta blockers. These come under names like atenolol, metoprolol, and carvedilol. So these are drugs that block adrenaline and thereby turn off your ability to lose weight. Antidepressants. Many antidepressants can block your ability to lose weight. Anti-inflammatory drugs, especially prednisone, can completely block your ability to lose weight and, in fact, usually cause weight gain, sometimes to astounding proportions. Many chronic pain medicines can cause weight gain. Now, of course, don't just stop these medicines, any of these medicines. You want to talk to your doctor. If your doctor is unwilling to work with you or talk to you, find a new doctor who will. Iodine and thyroid dysfunction, terribly common. If you live away from the ocean, that is inland, it's highly likely you have some measure of iodine deficiency, particularly if you avoid use of iodized salt. We've been all told, haven't we? Cut your use of sodium and salt. Well, guess what? People are becoming increasingly iodine deficient, just like we were in the first half of the 20th century. So much so, I'm even seeing people come back with goiters and large thyroid glands from lack of iodine. So we add back iodine. I personally like to use 500 micrograms of iodine per day in an inexpensive supplement such as kelp tablets, which are dried seaweed. A thyroid evaluation can be very helpful if you're stalled in weight loss, but most physicians will just check a TSH, a single value, and look no further, if they even look at all. But suffice to say that a thorough thyroid evaluation includes at least a TSH, a free T3 thyroid hormone level, a free T4, and consider a reverse T3 and thyroid antibodies, looking for all the different ways thyroid dysfunction can occur, and we aim for a TSH value of about 1 or less, and free T3 and free T4 thyroid hormone values in the upper half of the range that the laboratory quotes, the reference range. You want ideal thyroid status so it does not impair your capacity to lose weight. Cortisol and adrenal dysfunction is becoming a big issue. It's part of the world of endocrine disruption. We're all being exposed to this sea of industrial compounds, like perchlorates, for instance. These are the residues of synthetic fertilizer in your produce. How about triclosan from hand soaps and hand sanitizers? How about FD&C, red dye number 3? Very common, blocks endocrine function. We are being exposed to a long list of industrial compounds that block our endocrine function, thyroid and adrenal gland. And we're exposed to chronic stress. These are factors that mess up your cortisol levels. So chronic stress, one of the effects is a high cortisol level, an inappropriately high cortisol level that occurs in the morning, can even be sustained. Or a high cortisol level from chronic stress is just like taking the drug prednisone. It's like a steroid, and it causes weight gain or will block your capacity to lose weight. That requires a formal evaluation, usually salivary cortisol levels, and then you work with your doctor to examine how your curve of cortisol release works and how to address it. And that can take a while to figure out, but once you figure it out, it can often help facilitate weight loss.